Apologies, I had to switch to another network, and I hope you can all hear me. Hello?
Hello, I can hear you, Timsia. Timsia, we can hear you.
Doc, we can hear you, man.
I'm really sorry, the network today has just not been friendly, and hopefully it permits me to continue without further glitches. So Project Tekla leverages the ECHO model. We collect registration, participation, questions and answers, chat comments and poll responses for our program. Your individual data will be kept confidential and handled by authorized personnel. This data may be used for reports, maps, surveys, quality assurance, evaluation, research, and to inform new initiatives. And to let you know that this session is being recorded, and we'll also be sharing a PDF version of the slides and also the recording after the session. So these are a few participant tips that we'll be having to help you enjoy the session, of course. Kindly use the chat function to introduce yourself, give comments, and of course, ask any questions. Keep your comments respectful. This is a safe space for learning, so would really encourage that your comments, your questions, be respectful. I'll call on Dr. Esther, who is one of the operation officers with Farmalert, to give us a brief quickly about Farmalert for 2 minutes, and then we can move to the next item on the agenda. Dr. Esther, can you quickly?
Good morning, everyone.
Hello, Dr. Esther, we can hear you.
Can you hear me now?
Yes, we can.
Yes, thank you. Yes, so I'm Dr. Esther Olorunfemi, and I would like to welcome everyone to today's class session, themed UDDER Health Management. We at Farmalert are delighted to have you here with us, and we really look forward to having a beautiful session with all of you. At Farmalert, we are passionate and all about enabling easy access to affordable animal health across Africa. And this we have done for a few years now. Farmalert started out as a animal health social enterprise in 2019 and started in Lagos. But since then, we've been able to spread to some other states in the country. We've been able to spread to Ogun State, Abuja, Kaduna, and Niger State. We are really excited about having you here with us today, and we are sure that you would have a beautiful session even as we go on. We would like to have you join in on our other sessions as we go on. We have these secular sessions, and we would like that you join in as we go on with that. Thank you very much, everyone. Yeah. I'll be handing over now to Dr. Cynthia.
All right, thank you very much, Dr. Esther, for that wonderful and brief introduction. Next, we'll be having a brief about Project TECLA by Mariam Mukhtar, who is one of the associates with MDOC. And MDOC, MDOC is basically, or should I say literally, hand-holding Farmalert through this process. And so we'd have her to give us a brief about Project TECLA. Mariam, you can kindly come on for the next 2 minutes. Good morning.
Yeah, my name is Mariam Mukhtar. Please pardon me, I won't be able to share, to show, or rather use my video because I'm trying to manage my bandwidth. Yeah, so as I said, my name is Mariam Mukhtar and I'm a project associate at MDOC. And as Tumsia rightly said, I'll be giving a very, very brief account of how Project TECLA came to be. So MDOC is a digital health company that provides self-care support to people living with chronic and regular health conditions using technology. So the problems that MDOC seeks to tackle are related to health-related issues such as insufficient pre-service training and the shortage of health workforce that has currently been a bane in Africa generally. And this has led to the increasing number of migration of clinicians. So to support efforts to tackle these challenges, MDOC partnered with the Making More Health initiative. This is a combination of Boehringer Ingelheim and Ashoka, and also the University of New Mexico ECHO to apply tele-education to democratize knowledge. That means they want to make knowledge easily accessible to people and also curb these challenges that I have mentioned before. So TECLA was created in 2021 to expand tele-education opportunities for organizations which have capacity building as an important part of their business model. And that's where organizations like Farmalert come in. So TECLA basically leverages the ECHO model to build capacity and create North-South and South-South learning while being integrated into social enterprises business models. So far, it has been a wonderful experience working alongside Farmalert to expand these learning opportunities into the animal health department. And as always, I wish us all an impactful knowledge sharing session today. Thank you very much.
All right, Mariam Mukhtar, thank you so much. And that definitely, I think whoever does not know about TECLA would get an insight from this brief introduction of yours. Thank you very much. So we move to the next item on the agenda, which is the pre-quiz. And for those that are just joining, I stated earlier, they're just a group of questions from the presentation that will help us gauge knowledge before and after the presentation. So the poll will be launched for the next 3 minutes. There are 10 questions. And please, I implore you to answer the questions to help us track data. Thank you so much. We can now launch the poll quiz. So we'll have it on the screen now. As I said, they're just a group of harmless questions. So please feel free, and you're answering them based on anonymity. It's just to help us track data, as I stated earlier. Thank you very much. So the questions are up, and please, can we all engage and start answering the questions? We have 10 questions, and I can clearly see the engagement rate from here. So I would know whether or not people are engaging. So we have 3 minutes. We're 21 seconds into 3 minutes. So please make sure, can we all see the screen? Respond in the chat box if you can. And please go ahead and introduce yourselves and where you're joining in from. If you can see the chat, the poll quiz. Yes, okay. Someone said she can, so I'm pretty sure almost everyone can. So please.
Hello, Timsia. How
Yes.
do we respond to the poll quiz?
You select the answer.
From the screen?
Yes, from your phone. You should be able to do that. Okay, let's bring it down again, and let's bring it down. I don't know why you're not able to do that, but you should be able to answer it from your devices. Okay, quickly, 2 minutes, please. And so the questions are back up now. Hello. Kindly respond in the chat box if you can. Have we started? Please let me know in the chat box if you can answer the questions. Okay, that's good. So we have the next 3 minutes to engage the questions. That's good. Dr. Ada, I think because you're a co-host, that's why you can't attempt to answer the questions. So for the participants, they can, but as a co-host and a host, you won't be able to do that. And all see the question. Okay, people are answering. Please, more people can do this. We have just 4 people out of 24. We can do better. That's like 16% participation. You can just attempt the questions. You don't have to get it right. All of this information are embedded in the presentation. So when you attempt the post quiz, you'll be able to answer it better because now you've been exposed to the new set of information. So don't worry, you can just try your best and answer what you know for now. And then the post quiz, by then you'll be a pro. So you should be able to answer the questions well. We have 41% engagement, which is not bad. So we'll need more than that. We have 30 seconds to go. I implore more people to please answer the questions. Thank you all very much. Look, you're the one that will go down, down. Not yet. So we've ended the poll now. We can just move to the next item on the agenda. So Dr. Ada, can you please come up and share your screen? I think you're a co-host, so it will be better if you share your screen so you'll be able to follow your energy. So we can stop sharing our screen now, and then you can start sharing yours. Thank you all so much for answering the questions. We'll just go straight into the presentation. Dr. Ada, I think you can share your screen now. You have 30 minutes, so good luck.
Dr. Tumsia, can you confirm that my screen is visible?
Yes, yes, I can. Though you've not started sharing the presentation, but we can see your screen. Yes, now
I've started sharing the presentation now. Can you confirm?
Yes, we can see that.
Okay. All right. Good morning, everybody. It's nice to be here, and thank you, Tumsia, for this opportunity. I can see some very important persons on this call, including one of my teachers, Dr. Babashani. Greetings to you and welcome. My name is Dr. Ada Ogucha. I am the key account manager for Nigeria for Zoetis, and I work for the Sub-Saharan African office. I'm a vet. I graduated from Ahmadu Bello University, Zaria. I also have a master's in veterinary public health from the University of Glasgow in Scotland, and also recently completed an MBA at the University of South Wales in Wales, United Kingdom. I'll be talking a little bit about udder health today, and we'll have a quick introduction and talk about mastitis, how to control it, and I'll also introduce an innovative solution for the control of mastitis. Please confirm that I am audible and you can see my screen as well as hear me.
Yes, Dr. Ada, we can hear, at least I can hear and see you, so others can confirm in the chat. But I can hear and I can see you. So go ahead.
Okay, thank you very much. Just a quick background to dairy farming in Nigeria. Currently, Nigeria has the 5th largest cattle population in Africa. Ethiopia tops that list, closely followed by Sudan, Chad, and Tanzania. Of course, it is not new that the bulk of the cattle we have in Nigeria are indigenous breed. We have just about 1% exotic breed that is rapidly changing because of the advent of artificial insemination and commercialization of dairy farming. The average production of milk per day for our traditional indigenous cattle is about 1.6 liters per animal per day. And this is quite small as compared to what you would get from a Holstein Friesian, for example, that is able to produce up to 30 liters of milk per cow per day. Studies as well state that Nigeria has quite a low per capita milk consumption. Basically, the volume of milk consumed by Nigerians generally is quite low as compared to those of other African countries and other parts of the world. We're talking an average of 20 to 25 liters per individual per year, even though some studies as well say that this is as low as 8 liters. It's hard to say with certainty, which is correct. Now, this is quite small when you look at Kenya, with up to 110 kg per capita, Uganda with 63, Tanzania with 47, Rwanda with 38 as well. This basically shows that in other parts of Africa, dairy production has advanced beyond what we have here, but not just that, the enlightenment and the rate of consumption of milk and milk products is significantly higher in these countries than we have here. And this could also be due to availability, but also knowledge amongst Nigerians about the importance of milk and nutrition. So this sector is important, like Tantia said earlier on, because it's a virgin, I call it a virgin sector. Of course, we have been traditionally collecting milk for many years in Nigeria. Milk is sold as fura de nono. Couple of people collect fresh milk that they use for processing, but this is grossly inadequate. Currently, it's estimated that Nigeria produces between 500,000 to 700,000 tons of milk annually. However, the demand for milk and dairy in Nigeria is about 1.7 million metric tons, meaning that over 1 million metric tons of milk and milk products are imported into the country. And don't forget, with these 1.7 million metric tons, we're still at a low per capita consumption of 20 to 25 liters, which we should be growing. And it also means that if we were to grow, the need for dairy products significantly higher than what we have. We're importing far more than we're producing, and the tide just has to change for the sector to develop. Now, in recent times, the government has identified this as a major problem. You can see from my slide that it's estimated currently that $1.5 billion is spent annually on importation of dairy products. The government has restricted now the availability of forex for importation of dairy products so that the local industry can as well develop. And this has led to the establishment of different projects and farms and programs by different multinationals. And the sector is still very, very, much in need of investment and of expansion to enable us meet the local needs. Now, talking typically about dairy, the average lactation cycle. I want to start with giving us this background because I see that a lot of people do not really understand what the proper lactation cycle is and what it entails. So I want to start by asking a question, which I would like people to answer in the chat box. What is a average gestation period for a cow? Trying to go to the chat box. I want to see what the response is. What's the gestation period for a cow? To be good to get Okay, please keep it coming. Okay. All right, that's fine. I'm just going to go back to my presentation. Now, milk production is divided, or the lactation cycle is divided into 4 stages. I want to just run through these 4 stages because I think it sets the stage for what we want to talk about. So when a cow calves, the first 100 days is referred to as early lactation. This is where milk production is really, really high. You'll notice that the cow would lose some weight because of course body reserves is being used for milk production. This is also the time where nutrition is very important. Now, the second stage of lactation is called mid-lactation, which happens between 100 to 200 days. You would see that there is a drop in milk production, not so much, but it begins to drop after that peak that you saw during the first 100 days. And at this point, the cow begins to gain back some of the weight. The weight is a bit static. And even this is very important as well. And this is the period where you're supposed to increase the dry matter intake. The third stage is the late lactation, which is anything between 200 to 305 days, thereabouts, which is where the animal, the milk production drops significantly. So it's very important we understand this. And this is the period between when the animal is expected to calve again. Now, there's a period called the dry period. The dry period is normally estimated to be something around 45 to 60 days before the next calving. Important to note that it is expected that once your cow calves, you are expected to inseminate or mate that cow so that the cow becomes pregnant, within 100 days, 60 to 100 last calving. All right. So it means that throughout the period that you're milking the animal is pregnant, and then towards the end of the pregnancy, before the next calving, about 45 to 60 days, you just stop milking. Now it is estimated that if you stop milking for about 35 hours, the milk production will stop naturally. So you want the udder to rest so that when the new calf comes in about 60 days, the udder is ready to produce good milk that you'll be able to collect. It's also important because that is the period that a lot of the infection ends up happening in the cow. I think I've dwelled so much on the slide already. So, ladies and gentlemen, we'll be talking today mostly about mastitis. Mastitis is an inflammation of the udder. This is a typical bovine udder. It's divided into 4 segments. The beauty is that the hind quarter, which is the udder closest to the hind limbs or the back legs, is a lot bigger than those, a bit forward. That's those closer of facing the front of the animal. I'm trying to use them as very simple terms as possible to make understanding quite easy. And this back quarters produce up to 60% of the milk So you see that even when you have the forequarters, the hindquarters are even more important than the forequarters because the hindquarters produce far more milk. They are much bigger. And the beauty is that these four quarters are totally separated. Anatomically, they are not connecting with each other. So it means that one quarter can be infected while the other quarter is perfect. All right. And it will require introduction of, germs or microorganisms into that perfect quarter for the quarter to have any problem whatsoever. This just to give us a brief understanding of what it is. Now, inside the udder, there are some cells, there are villi, there are some tiny, tiny cells that help or that are responsible for the production of milk. And the challenge with mastitis is that when mastitis sets in and starts damaging these small, small cells, over time, the cells that are producing the milk become so damaged and many of them may not be able to produce milk anymore. And gradually, the milk production from that udder or that quarter begins to reduce. And this is what we want to prevent if you are a dairy farmer, because you do not want the volume of milk production to drop in any of the quarters. So there are different diseases that can affect the bovine udder. There is it could have an abscess, could be some wounds, maybe from fighting. You could also have some edema, for example. Sorry. You could have some other disease, affecting the udder that are not necessarily mastitis. But today we're talking about mastitis, which I defined earlier as the inflammation of the udder. It's caused by different organisms. It could be virus, even fungi, but mostly, I would say 99% due to bacteria. And there are two types of mastitis. There's clinical mastitis, and also there is subclinical mastitis. Now, what is clinical mastitis? Clinical mastitis is basically mastitis that you are able to see, okay? So mastitis, like I said, is the inflammation of the udder. So if it is clinical, you could see it in the form of swelling of the udder. It could be that when you're touching the udder, the animal is feeling pain. The udder could be warm in feeling when touching it, or it could be swelling. It could be swollen. There could be some swelling at the udder. But beyond that as well, when you are collecting milk, you could see changes in the milk. You could see that there are clots or lumps inside the milk. You could see even pus in the milk. You could see that there are flakes in the milk, or you could even see that the milk is exceptionally watery, or even blood in milk. So, or sometimes you could even see color changes. You could see that the udder is red, due to the inflammation. So when you see this kind of situation, it is called clinical mastitis, because it's visible. You can see it, you can feel it, using your perception of sight or touch, and even smell. In some instance, you are able to see that there is a challenge with this particular udder or with this milk that you are collecting. Of course, there are different grades of it. There's grade 1, grade 2, grade 3, which is determined by where you find the changes. If it's just in milk, it's grade 1. If you find changes in milk and as well as the udder, you call it grade 2. But you could also find changes in both milk and udder, and as well, you could find systemic illness in some instances due to mastitis. So for subclinical mastitis, which is the typical opposite of clinical mastitis, this simply means that there is mastitis, but it's not visible. You're not going to see swelling of the udder. You're not going to see blood in the milk. You're not going to see watery milk. You're not going to see pus. It looks like everything is okay, but no, everything is not okay. And you would only notice probably that there is a decrease in milk production. So Please, can you just double check, just me double checking that you can see my screen?
Yes, Doc, we can see and we can hear you.
Okay, awesome. So moving on from subclinical mastitis, I just talked about two types of mastitis. Clinical mastitis, where you can, as a farmer or as a vet, you can easily diagnose from your sight, from your feel, from your smell, and from the milk itself. And in subclinical, you are not really able to tell. You just see that there's a decrease in milk production. Sometimes the decrease is so minute that you might not even see it as mastitis, or sometimes you wouldn't even realize that there's any decrease at all, but there's a challenge. So what really causes mastitis? I said earlier on that it's mainly caused by bacteria, and there are two different, categories of bacteria that cause mastitis: contagious and the environmental bacteria. For the contagious bacteria, basically they are organisms that are normally transferred from animal to animal, or maybe from, via the milker's hand, in sometimes through the milking machine and equipment used on the farm. There are some organisms that are easily transferred via this route. But as well, there are some environmental bacteria that can also cause mastitis. These are opportunistic. They are present in the environment, and it has to do as well with hygiene, management of the teeth. They basically come from outside in. Whereas for some of the other organisms, they're contagious. They're transmitted from animal to animal, or sometimes via equipment, like I said earlier. That is not to say that the hand or the equipment can also not transmit the environmental bacteria. No, they can. But basically, this classification is based on where these organisms are easily found. Why is mastitis important, and why are we talking about mastitis today, and why is mastitis discussed around the dairy industry a lot? It's said that mastitis is the single most widespread and costly disease of dairy cattle, and it occurs throughout the world. There's no part of the world that they don't have challenge with mastitis, but it is the most important disease of dairy cattle. So if you're setting up a dairy farm, you have a dairy farm, you're supporting a farmer that has a dairy farm, you cannot afford to ignore the most important disease of dairy, which is mastitis. Unfortunately, it is also, in this part of the world, the most ignored and an overlooked disease of dairy. And perhaps that is one of the reasons why we need to change it if the trajectory of our dairy sector will also change. So I've talked a lot about mastitis, what causes it, how it is transmitted, but why are we, and I also defined what mastitis is and why we are focusing on this. But it's important to note that we say mastitis is the most important disease of dairy, not just because we want to say it, but because we need to understand why it is the most important disease of dairy. First of all, I described earlier on how mastitis damages the alveoli cells of the udder, leading to reduced milk production. So yes, mastitis causes decrease in milk production. Because mastitis can be a problem, we're always administering antibiotics. And ideally, we know that when milk is collected in the proper dairy setting, it is tested for antibiotic residues or drug residues generally. And if there's any drug in it, it means that you have to discard it. So if you have mastitis, you are treating, you have to discard milk until the dry period. And the milk you're discarding is significant money you are losing. So mastitis also spread easily from cow to cow. So the fact that one cow has mastitis and the other doesn't mean that you'll not spread easily. You use same milking equipment. Sometimes the same person is milking both animals, and hand hygiene, a little complacency, in the hand hygiene could also lead to easy transmission. So you are losing more and more when it is transmitted really fast. Of course, we talked earlier on about the quality of milk, reducing the flakes, the pores, the watery nature. And that means that farmers will struggle to sell poor quality milk. Mastitis also cause suppression, immune suppression, which can lead to other comorbidities easily. Of course, you spend money for veterinary services and veterinary medicines and for testing. And when the udder of a cow is destroyed by mastitis, you would have no choice than to call that cow, because you cannot keep feeding a cow that is not producing milk. So mastitis will lead to culling, and means that you may sell off that animal at a very cheap price. And in some instances, mastitis can also cause mortality. Studies have shown as well that mastitis reduces the fertility of cows. So these are just a few of some of the many things that mastitis causes, and why mastitis really is important for farmers to handle, and why mastitis is a major cause of economic loss for many dairy farmers, or rather for all dairy farmers around the world. A lot of studies have been done around the world. It is estimated in Netherlands that farmers lose as much as 261 euros per animal per year due to mastitis. In the UK, 250. A study in Nigeria said 5,005. While this study was done in Nigeria and while this value looks small, we also have to take into consideration the fact that our traditional cows produce quite little milk. So the analysis that this author have done was based on that as well. And as also the fact that there are not many treatment management options for mastitis around here. A recent study have updated this and estimated it to be about 6,000 plus. But as the sector improves and more research is done, I bet you're going to see that the loss is going to be significant. And it's very important to mention that more than 60% of mastitis is due to subclinical mastitis. So we have to really be on our toes to be able to control mastitis if we want to make progress. And studies have shown as well that for high-producing cows, mastitis can cause as much as 6 to 12 liters loss per day in one cow. You can imagine the economic loss if you are losing up to 12 liters per day per cow on your farm. So this means that subclinical mastitis is really important. We need to be on our toes to identify and to control. How do we detect mastitis? The easiest and most common test is the California mastitis test. In this case, you just squirt some milk into the CMT paddle. Basically, to carry out a California mastitis test, you need two things. You need the reagent, the CMT reagent, and you need the paddle. So with this paddle, you just collect milk into the paddle, add the reagent, about 2 ml each, and then you just swirl a little. You're a farmer, you're a vet, your farmer should have a CMT reagent and a CMT paddle compulsorily. And ideally, CMT test for a lot of in the developed parts of the world, this is a test that is done routinely, probably once a month, once a quarter, for all milking or all lactating cows to be able to detect mastitis early. If you look at the last picture, you see that after swirling, after mixing, collecting the squirts of milk, 2 of them in each, so that you can test for each of the 4 quarters. You are able to tell which quarter has a challenge. You can see at the top right hand, when you look at the CMT paddle, you see how thick it has become, the purple and very jelly-like, jelly-like, I call it a mixture there, due to the fact that that particular order has mastitis. And you can see them in different categories as well. So this is
Dr. Adam, let me cut you a little. I think you have, I can give you 15 minutes if we can quickly round up.
Okay, that's fine. That's
All
fine.
right.
15 minutes. Okay. So having said that, basically what you are trying to measure here is to see if the cow has mastitis. You can tell if you want to dive deeper, depending on the kind of reaction you get. You're able to say, what category of mastitis you might be dealing with, or what is the somatic cell count that you might be dealing with. It's estimated, or it's general industry standard, that milk is not sterile. There are always lots of bacteria in milk. But if you get more than 200,000 SCC or cells in milk, then that is a milk that is mastitic. So how do we control mastitis? There are 10 commandments of other health management. The first is to use proper milking management methods. So you need to ensure that hygiene is, your process of milk collection is proper. If you're using hand milking, you're using machine, you have it all properly set up. There should be proper installation and maintenance of the milking equipment. That's really important. It is very important that you do what we call dry cow management as well. Doing the dry cow management significantly controls mastitis. I'll come in the environment. And you need to also how much you want to control mastitis. So what is dry cow therapy? Which I said earlier. You remember earlier on that I talked about dry cow period. Dry cow period is just that period between when the last milking and the next calving. So 60 days before your expected calving, you're supposed to stop milking the cow so that you allow the udder to rest. Now, this is the period that it is recommended that you do what's called dry cow therapy. Now, there are two types of dry cow therapy. One is the teat sealant, and then the other is the antibiotic dry cow therapy. Now, for standard mastitis control, you can choose to use one or both of them. For the teat sealant, it's just a jelly-like sealant that you introduce into the udder to sort of plug or block the udder to prevent bacteria and other external organisms from coming in. And the antibiotic dry cow therapy is also another intramammary product that you introduce into the udder so that during that resting period, you are treating any potential bacteria that might have caused or that might be causing inflammation or that will be causing mastitis, so that when the animal calves, the udder will be in perfect health and you are getting the volume of milk and you are sure that to a large extent you will not be encountering mastitis during the lactation period. There is also the combination of both, where you introduce the antibiotic therapy and then you also plug the teat with the teat sealant. So this is the standard, and in a developed world where dairy is really advanced, it is a standard that every lactating cow would, have some form of dry cow therapy during the drying off period. So I'm not going to dwell so much on this. How do you do intramammary infusion? I'll just run through it briefly. This is not what many people are familiar with. It's expected, first of all, you have to keep records. You wear your glove, disinfect your hands, or rather, hands and wear your gloves. you have to milk out the quarter completely. So anytime you want to give an intramammary infusion, you need to empty the udder of milk. And then you disinfect the teeth with a swab, and then you take the intramammary infusion. It normally comes like an injection, but not the regular injection. You're supposed to put it right into the teeth canal, and you try not to touch it. You just open it. There's always a cap. Open it, insert it into the teeth, and then you push it in. And then when you infuse the intramammary antibiotic or the teeth sealant in, you massage the udder gently, and then you apply the regular teeth tip, which is standard when you're milking. So that's how to do an intramammary infusion. Now, there are different things that can be used. Intramammary infusions are not very common, not every day that we see them. There are specific intramammary infusions that are called dry cow therapy. Now, these dry cow products, normally if you see an intramammary infusion, you see a DC or an LC after it. Now, DC simply means dry cow. It means that this is supposed to be used during the dry cow period. And it's normally a long-acting antibiotic. It is an antibiotic IM infusion. It's normally long-acting because there's a long period where the teeth will not be actively milking. So it's expected that the antibiotic is able to control bacteria in the udder during that period. You also have the teeth sealant as well, which I said is sterile. It's just like a jelly plug, just to prevent external organisms or bacteria from going into the teeth. To use a teeth sealant, however, you need to, at least know the status of that udder to be sure that there is no mastitis and you're only trying to prevent mastitis. So, but then there are also lactating cow products. Now, lactating cow products are products that can be used during lactation. It means that you can discover that your cow has mastitis during lactation, and you can treat during lactation to ensure that you control it, to ensure that milk production returns back to normal, to ensure that you prevent bacteria from damaging the alveoli and causing reduction of milk production. So I want to introduce you to one which is available in country, in Nigeria. This is the only one I know as well that is available in Nigeria. A combination of amoxicillin, clavulanic acid, and prednisolone, which is a combination of an antibiotic and an anti-inflammatory to control inflammation, and quite used for control of both gram-positive and gram-negative organisms. The beauty of it is that you normally lactating cow therapies have short withdrawal period. And the reason is because while you are using it in lactation, you do not want a long withdrawal period. You just want to be able to treat the udder and get it back to milking. Of course, when you are treating that particular udder, you are expected to discard the milk because you do not want antibiotic residues. But the advantage of using an intramammary infusion is that if you're giving a systemic antibiotic, what you are used to giving an injection at the neck or at the back, you realize that the antibiotic will get into all the milk that your animal is producing. So you have to discard all the milk. But when you are using an intramammary infusion and you identify a particular udder or quarter that has a challenge, you're able to treat only that one quarter. Remember I said earlier on that the 4 quarters are anatomically independent of each other. So it means that one quarter can be sick and the other 3 are healthy. So you're only treating that one quarter and you're collecting milk from the remaining 3 and making money out of it. But the beauty as well is that because you're administering this therapy locally, it is able to work much more rapidly and it's able to have localized action that will help you resolve mastitis much, much faster. So, of course, lactating cow therapies come with different withdrawal period. This particular one called Sinolox has about 84 hours withdrawal period after the last injection, or rather infusion of an of one of the syringes. It's always and lactating, or rather intramammary infusions are always coming in a pre-filled syringe. So it means that the syringe would contain the agent, and you just administer directly into the other, and it has to be in a sterile way. So studies have shown that a combination of antibiotics and anti-inflammatory are more effective for controlling mastitis than just using antibiotics. So this is very important generally when we are controlling mastitis. And this studies just echoes what I said as well in terms of the advantages of using an anti-inflammatory in combination with an antibiotic via the intramammary route if you want to control mastitis. I think that brings me to the end of my presentation.
Thank you so much.
Dr. Timsia, over to you.
Yes, I'm here. Thank you so much, Dr. Ada, for that beautiful presentation. I would say you've done justice to mastitis, and I hope each and every one of us on this, you can stop sharing your screen now. And I can say each and every one of us here, I hope we've been able to take as much as we can and be able to apply it to either, on our farms, which is very important. We have questions already coming. We have from Dr. Mohammed Babashani. So he's asking, I think he asked, there's a question before now. I'll read out that question. And Dr. Ada, you will be answering these questions before we can, because I would also like to give Dr. Mohammed Babashani some few minutes to say one or two things as an expert in ruminant practice. He'll also have, I'm sure he has something important to add. So Dr. Babashani is asking, how does mastitis affect fertility of dairy cows?
Okay, I think
Hello?
Hello? Yeah, I can hear you. Yes, I'll respond to the two questions. Now, I would say that that understanding is not very clear. However, studies have shown over time that cows that have mastitis found it harder in some instances to take in when you do AI. So there was a study that compared the fertility levels of cows that were said to be free of mastitis and cows as well that had mastitis. And the study proved that cows that were without mastitis had a higher fertility, and generally mastitis was linked to having some effect on fertility of cows. Okay. There are a few studies to that effect, which I can share with you, Dr. Babashani.
All right.
Okay, can I respond to the second question? Because
yes, please. Yes, please.
Okay, now this is a real challenge because adherence to withdrawal period is a problem. However, the beauty is that in the industry today, with the kind of investment that is coming into the dairy sector, especially with multinationals and other big companies that are dairy processors, they are also trying to keep farmers on their toes by testing milk for antibiotic or drug residue after collection. So this is, I would say that this is something that vets and farmers need to be, to take into consideration. And this is a campaign that the industry should be very serious about. both from the side of farmers and from the side of dairy processors. Because if the farmer understands that my milk can be rejected if there are drug residues, then the farmer will understand the need to adhere to withdrawal period. So, of course, this is a challenge, but like we said earlier, the advantage of using intramammary infusions is that this is significantly reduced as compared to the use of systemic antibiotics, which is a norm today. But yes, there's a lot of work to be done, for that to happen, for adherence to happen.
Okay, thank you, Dr. Ada, because there are more questions coming. And I also want to hear from Dr. Babashani, but I think you'll take one or two questions. And Clara Akban is asking, is there no possibility of the drugs being infused into the UDDER getting into the systemic circulation?
No. Intramammary infusions, the way the order is the anatomy of the order really has a barrier, between systemic circulation and blood flow into the order. And generally, intramammary infusions would remain within that order, and that's why that's why the standard for controlling mastitis is intramammary infusions. So no, that is not a concern when using intramammary infusions.
Okay, beautiful, beautiful, beautiful. More questions are coming up. We have from Shahid Adioti, and he's asking, does pasteurization destroy germs in mastitic milk?
Yes, the aim of pasteurization is to kill microorganisms that can be harmful. So yes, pasteurization will kill the germs or will kill the organisms in mastitic milk. However, remember that our concern is not just about the mastitic milk. First of all, the quality of the milk is affected. So if you are using the milk if you are going to process the milk, it means that you're probably not able to use the milk for what you want. You want to make cheese, you want to make yogurt, and you're not able to use that milk the way you would like. It won't give you the quality of products that you would want. Beyond that, the mastitis, the mastitic causing agent itself is busy damaging the cells of the udder, and your milk production will be reducing gradually. So yes, if you get mastitic milk and you pasteurize, yeah, you can say that it's healthy, However, the bigger picture is that the udder is being damaged, milk production is reducing, you are losing more money, and if you are a processor using that milk for something else, you're not getting a quality end product, and that's not what we want.
Okay. All right, so I would say that based on this question, if pasteurization destroys germs in mastitic milk, and I'm not a pro in the dairy industry, but I definitely know in places where things are working, they check for this. So it doesn't even get to the industry with the mastitic germs in it, right, Dr. Ada? So they have their on-field tests that they do to check for the quality of the milk they're collecting. So I'm sure it doesn't even get to the factory for them to even pasteurize and get rid of the mastitic milk. So another question here is, what are the differentials for mastitis? What other conditions can be confused with mastitis?
I think I showed a particular slide in my presentation where I said that there are some, differentials that can be mistaken. And I talked about maybe edema, for example, or maybe an abscess around the udder that can easily be, mistaken for mastitis. So if you have an udder edema, normally that is something that is physiological due to nutrition, fluid accumulation, but it gives you a semblance of an inflamed udder. So that can sometimes be mistaken for mastitis, but it's actually mostly nutritional. We also talked about abscesses, which could be due to maybe some trauma from horn or whatever at the udder. But there are a couple of other things that could even affect the udder, or that could even kill off the udder, that are not mastitis. For example, LSD, lumpy skin disease, could sometimes spread to a point where, you know, the udder is, you know, the udder is destroyed if not properly managed. You could even have warts and all that. So there are a couple of other things that can affect the udder that are not necessarily mastitis. Of course, you're going to see the lesions in those instances. We didn't discuss any specific external lesions for mastitis, aside the swelling and the pain and the reddening and the heat. So you would be able to tell. But for the edema and maybe some abscess, yes, that can be a bit confusing. But these are things that you're able to tell as well if you have experience.
And for everyone asking, I hope your questions, the answers are tailored, you know, to your expectations. I hope, because you need further clarification, we still have time, and the chat box is open for you to ask more questions for clarification. So there is another question here for you, Dr. Ada. They said it's from Idris Salisu Idris. And he's saying, when human or calf take milk from dam that is suffering from mastitis, is there any effect on the human person or the calf?
Okay, a very interesting question. So there are instances where when a calf is maybe having, say, diarrhea, and there's a suspicion that it's the origin of the diarrhea might even be the milk from the cow, and you're required to separate that calf and administer treatment while providing milk from another source to the cow. Because yes, in some instances, when the organisms in the milk are really high up there, the calf can have some effect on the health of the calf. A lot of times, maybe E. coli, for example, can be implicated in this, leading to diarrhea in the calf. So yes, that's a possibility. In humans as well, let's not forget that even the milk that we consume generally is not sterile. Once it's fresh, it's not sterile. Milk is generally not sterile. So, but yes, there's that possibility that consuming mastitic milk from an animal could lead to some gastrointestinal disturbance in humans. But that is quite relative as well.
All right, thank you, Dr. Ada. And I think that's it for the questions as far as I can see, except if there are anyone who wants to give comments.
Somebody asked a question about between dairy product and breast cancer.
Oh, I think I must have missed that question. Oh, okay, yeah, that's it from Shahid Adioti. Okay. Okay.
I'm not aware of a direct relationship between mastitis and breast cancer. I haven't really seen a case of breast cancer in a cow before, of course, but I am not aware of any specific direct relationship between mastitis and breast cancer.
Because that question, I would love to understand where the participant is coming from. Is he talking about breast cancer in human or breast cancer in the cattle itself? Shahid, if you can give us some, so we can have a clearer question. So are you talking about the relationship between dairy product and breast cancer in human, or breast cancer in the animal itself?
In cows.
So I'll presume it's human though, because he's already talking about products. Since of course humans consume dairy products, but let me not assume. You can further clarify your question in the chat box. I can't see any more questions coming. So I would love to give Dr. Babashani 5 minutes from our time, of course, because of his vast knowledge. in this field to share one or two things about this topic. Dr. Babashani, I would ask you to unmute yourself now. Just doing that so we can hear. Okay. Okay, Dr. Babashani, we can hear you.
Yeah. Good afternoon, my colleagues and my friends. Thank you very much, Dr. Ada, for a wonderful presentation. Mastitis is quite a huge problem to the dairy industry, particularly the fact that it's production and then affects the economic output. My interest is more on obviously, if you see clinical mastitis, you know it's the animal has mastitis and you begin to treat. But with subclinical mastitis, it's not clinical, so you cannot see the signs of inflammation in the udder. So it works on the ground, reducing productivity from the cows, affecting, I've read a couple of papers saying it's the subclinical usually affects fertility of the cows. So without proper diagnosis, you won't know that you have affecting your the general performance of your cows. Also, concern is that animals that are treated with these antibiotics, the farmers will now fail to discard the milk because of course, you know, economics is affected. So they will now channel it to supply chain, and then it will go to end up in the fura de nono supply chain. This is really of public health concern. To make is that once you are on therapy, you have to keep on milking the cow. Once you stop milking, then the cow will stop milk. So you have to keep on milking. But the recommendation is that it doesn't end up in the human. Farmers end up in a dilemma whether to use it for human consumption or to discard it. And particularly the local farmers will prefer it ends up in the local food chain where there will be no antibiotic residues or mastitis in the milk. So this is one thing that requires enforcement from the law. I wanted to ask Dr. Ada the cost of this intramammary infusion, because they are willing to buy, but they say it's too expensive for them. So I don't know what the cost is for right now. Thank you very much, Tumsia.
All right, thank you so much, Dr. Babashani. Dr. Haddad, you're asking about the cost implications of your products. We all know Zoetis doesn't come cheap, but they come good. Most people are thanking you here. Okay, go on.
Okay. Tutia and Dr. Babashani, thank you very much for your contribution and for some of the things that you added. I really agree with you. A lot needs to be done, you know, to prevent milk with antibiotics from going back into the value chain. As for costs, I'm not able to specifically give you a cost right here because even though I am key account manager for Nigeria, we work with commercially. Zoetis has registered distributors that market the products like this. So what I would do is on the chat box, I'm just going to provide a phone number and you know, and probably an email that people can follow up with to get updated. And I don't think these products are really expensive. When you look at the value of milk and milk to be discarded and losses, you would see that these products are really, really cheap. So it's not true when when we think that they're expensive. I'm just going to drop a number, Dr. Tumsia, if I'm allowed to do that, fine. Otherwise, I would say that anyone can reach out, subsequently.
Okay.
Dr. Tumsia, is that you have to give the go ahead for that?
Yes, you can drop your email for people who need further.
Okay, that will not be my email directly. Okay. So I'll just drop a phone number, and I would say okay. This so of course inquiries can be made here, but I'll drop my email as well.
Okay.
Not necessarily for anything commercial, but if you have questions, if you want to discuss mastitis, if you require some technical support, say for diagnostics on your farm, or you need some advice, I'm happy to support you with that. My name is Dr. Ada Oguche. You can include my email in the slides, Dr. Tumsia.
Yes. I think at the tail end, before we share the slides with them, your email will be attached so that, even for people who are not able to join, can have access to your email and contact you for further clarification. Okay, Mr. Shahid Adeoti is back, and he said, breast cancer in human as a result of milk consumption. He read it in the Punch newspaper. Okay. That's new.
That is new to me, Doc. And this is something that I'll probably take up as well. Are you able to, do you still have access to that publication in the Punch, and are you able to share?
If he can be able to share what the edition, what date, what month, what year, I think it would be great to refer back to see, because this sounds alarming, or should I say it sounds scary, whatever it might be. But other than that, I would also like to give, we have Dr. Shehu Shamsu, who is also a very senior colleague of mine. I'll give you three minutes to say something, and then we can finally take our expert recommendation generally on this topic from our hub experts. Some few announcements, we'll take our post quiz, and we can call it a day. Dr. Shehu Shamsu, I would ask you to unmute, and you can just say one or two things about the topic. Thank you, sir. Dr. Shehu, are you with us? Okay, so maybe he's not. Wait, maybe he'll send us a message when you're okay to speak. So Dr. Ada, we'll be taking, let me share my screen from my end. Can we have the screen up, please? Thank you. Okay, our screen is coming up. So we have the next item on the agenda. I would say it has been an interesting session, and Dr. Ada's email is in the chat box. You can reach out to him for further clarification, technical support, as he stated earlier. So we're going to launch the post quiz. They are still the same set of questions for those who are just joining. And there are questions from, we had a pre-quiz at the beginning of the session, and we also have a post-quiz at the tail end. So this basically helps us gauge knowledge gained during the presentation. So we'll have the post-quiz up now, and you will be able to attempt the question. So we have 33 people in the session, and on the session, sorry, and oh, another question is coming. And I think it looks, so Dr. Ada, let's quickly take this. It's from Peace, before we launch this, from Peace Titi Gabi, and she's saying, is refusal to feed young ones related to mastitis, though the UDDER looks normal? I'm trying to understand the question, but maybe Dr. Ada.
Hello.
Dr. Ada?
Yeah, I just saw that question. I would say not really. There are different reasons why a cow could refuse to feed young ones. Reasons, there are so many reasons, but however, there is still a possibility that if a cow is feeling a lot of pain at the udder, then the cow would not be very willing to feed the young one. In such an instance, I would say that the farmer or the vet should, touch or massage the udder. If there is pain and there is a reaction to pain, then that could explain why the cow may not be very willing to feed the young one because of the pain felt when they are feeding. But I would say at first sight, that's not what would come to my mind. Yeah.
Okay, thank you so much, Dr. Ada. And for Peace Titi Gabi, I hope your question has been answered. So she's saying, okay, thank you. And I'm sure, Dr. Ada, you're reading the chats. People are applauding and saying, a good presentation, and I will agree with them. It has really been an interesting and insightful one. So as I stated earlier, we'll move straight to the post quiz. So can we have the post quiz? Can we launch the poll now? We have 3 minutes for these questions. So I implore each and every one of us to engage. We'll have it up shortly. Thank you. Can we have the poll up? Oh, someone is saying very interesting and easy to understand. Okay, so the quiz is up, same set of questions, 10 questions. We have 32 participants in the room, and we have 3 minutes to attempt the question. So I implore you, you're answering based on anonymity. Your names are not showing, neither is any of your data attached to the response. It's just to help us gauge, because the ECHO model is big on using data to monitor outcome. Of course, if you want to monitor the outcome of anything, you have to have quantitative measure to what you're doing. So this is our own way of making sure we're tracking and the outcome of these sessions. So each and every one of us, we have 2 more minutes to go. I can see people have started attempting. Let me know if you can see it in the chat box, or let me know if you can see it. Okay, I think Ekwe Chinwendu can see it. Let me know if you can see the questions in the chat box. Thank you. More people? Yes, 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 yes. Kindly engage. It's moving up, but not as I would have expected, so we can do more. Thank you all so much once again. After this, we'll take our expert recommendation, some few announcements, and we can call it a day. It has been a beautiful and a challenging 2022. Looking forward to 2023, God's willing. So let's have an interesting session. So it's part of our memorable 2022 events. So we have 17% participation. I'll need much more than that. More people can do that. We still have about a minute to go. It's going up, 32. I'll need at least a 50% participation rate before we can pull down the full quiz. So let's go, let's go, let's go. More people are. Yeah, 50%. So I'm going to be Oliver Twist. I'm going to ask for more. So I'll need more than just 60%. Impressive. We can have more. What if I ask for 100%? Will it be too much? We still have about 30 seconds to go. So I think we can still make it. We can still make it. We can still make it. So none of your data is attached to this answer. We don't even know where the answers are coming from. We just want the data, that's all. So nobody's coming for you. 71%, that's not quite bad. So in the next 10 seconds, we'll be pulling down the poll and all right. So 75%. So I think we can end the poll now and share the results. So let's end the poll and share the results. And we can ask our hub expert and he can give us the answers side by side. So we know what we have done. Can we end it now? Yes. Let's share the results. Okay, Dr. Ada, are you with us? Okay. Quickly. Yep. Dr. Ada, you can.
Hello?
Yes, we're with you.
Yeah, thank you. I can't see the results. I don't know.
I'll read out the questions.
Okay, can you pull anything up on the screen so that I can see?
Yeah, it's actually on the screen. Can you see it?
I can't.
Oh, wow, that's strange. Can we all see the results on the screen? Let's see.
Okay, it just came up now.
Okay, you can see it now, right?
Yes.
So we'll just run through the questions and you would give the right answer. So the first question says, Nigeria has the 5th largest cattle population in Africa. True or false?
Yes, it's true.
So that's good. So we had, of course, 96%, though we'll be able to compare it to the pre-quiz. So a cow produces the highest amount of milk during which period?
Okay, this question is a bit tricky because I noticed a little mistake from the question I sent. So
Okay.
the first option is supposed to be the first 100 days after calving, which is early lactation.
Oh.
And, yeah, so.
So the answer is supposed to be the first 100 days.
Those who selected the first and those who selected the second. So based on this, yes, I would say that the right answer is, I wouldn't give any of them the right answer, but I would say that I understand perfectly well those who selected the second option.
Yes.
So the right answer would be that the highest amount of milk is produced within the first 100 days after calving.
Okay, first 100 days after calving. Okay.
Yeah.
So third question says, mastitis is the inflammation of the UDDER. True or false?
Yes, mastitis is the inflammation of the udder. So
91% got that right. So select the correct statement. Mastitis leads to reduced milk production and loss. Clinical mastitis is visible, while subclinical mastitis can be seen only after testing. Mastitis causes coughing in cows. So 61%. Dr. Ada, which is the correct statement?
Both of them are correct, actually.
Okay.
So Yeah, so those who
So we have
selected,
61% and 39. So for those who
so you can
chose
add
first,
61 plus 39. So we'd say 100% got it right.
100%. So both
yes,
statements.
mastitis leads to reduced milk production, and clinical mastitis is visible, while subclinical mastitis can only be seen after testing.
Okay. I love this question because I can see the response. They said, what is dry cow period?
Yes, perfect
think-
answer, 100%. And I was particular about this. I stressed it because I see that the dry cow period is something that we're not very used to around here. And I wanted people to know why it is important and why the dry cow therapy is also important. So yes, excellent. Thank you, everybody.
Excellent attempt.
For your response.
So question 6 says, what is intramammary infusion? Dr. Ada?
Okay. Yes, medicine
the second
administered
statement
directly into the udder is the correct answer.
So 96%.
Yeah, 96. That's excellent as well.
Impressive. Question 7 says testing for mastitis helps farmers diagnose clinical and subclinical mastitis. True or false?
Yes, that is very true. We said earlier on that even though with clinical mastitis is visible, you can diagnose it physically. You can also confirm by doing a test. In the case of subclinical mastitis, you can only tell after doing a test. So yes.
Well done, everyone.
91%. Well done.
Yeah, question 8 says, which of the following is not true when administering an intramammary infusion? The quarters should be milked out completely each time prior to drug administration. The UDDER should be gently massaged after administration. The intramammary infusion should be administered before milking and quickly milked afterwards. Dr. Ada?
Yes, this question made me feel like a teacher because I know it's a bit confusing. So yes, 61% got it. Yes, I said earlier on that if you want to administer intramammary infusion, it's very important you milk out the cow, like Dr. Babashani also echoed. While administering intramammary infusion, you have to actively be milking. And every time you want to administer, you milk first, then administer. It's just, let me use an illustration. If you want to put, let's say, sugar inside a cup of tea, of course, if the volume of water is, or the volume of the milk of the tea is small, you know that your sugar will be more effective. But if the volume of the milk is, a jug, and you're pouring your sugar inside, you know that you will not feel the impact. So it's almost a similar thing with the udder. There's a lot of milk in the udder. You want to administer an antibiotic. You rather remove milk out and discard because you administer antibiotic, so that, and then administer the antibiotic. It allows for, the medicine to be more effective rather than, administering when there's a pool of milk there where it will just sort of dissolve it. So I said that you empty the udder and then you administer the intramammary infusion, and then you massage gently to allow it to, disperse. So yeah, the answer is 61% correct. Yeah.
I'm happy most people got it. So dry cow therapy, question 9 says dry cow therapy should be used while an animal is actively lactating, during the dry off period, and before the next lactation, when there is no water in the environment. So Dr. Ada?
Yes, while an animal is actively lactating, the animal is using a lactating cow therapy. Remember I said that for intramammary infusions, you're going to see them written DC and LC. DC is to be used during the dry period. LC is to be used while it is actively lactating. DC will normally be longer acting, while LC will be shorter acting because it's actively lactating and you want to go back to collecting your milk. So yes, the answer, 91% of people got it. It's using it during the drying off period and before the next lactation.
All right, well done, everyone. And lastly, Question 10 says, select all that applies to Sinolox LC as an intramammary infusion. It contains
All
antibiotics.
the answers here are correct. It contains
Okay.
an antibiotic to control bacteria and as well as an anti-inflammatory agent to control inflammation. It has a short withdrawal period so that the farmer can go back to collecting milk and making money. And finally, it is effective in the control of both clinical and subclinical mastitis. So everybody who selected any answer here got it right.
Okay, so well done, everyone. And Dr. Ada, a comment just popped up and someone is saying you should have, you ought to be a lecturer. And I completely agree with the person. I agree 101%. So we can stop sharing the screen. Thank you. Stop sharing the results. Stop sharing the results, please. Okay. So lastly, as I said, we're going to give Dr. Ada another 3 to 5 minutes to give us a general expert recommendation on today's topic, announcement, and we can call it a day. So Dr. Ada, 3 to 5 minutes.
Okay, I'll start by answering a question somebody asked, which is to say, what's the level of penetration that the intramammary infusions normally have, or how far should a vet or farmer go in? And intramammary infusions have, some small cannulas, so you cannot really go beyond it. It's already prefixed, so it's, allows you to go to a decent length, and that will be just it. You cannot really push further. Anything beyond that will be causing trauma to the animal. Generally, to round up, I would say mastitis is important. If you're a farmer, you're a vet, you intend to set up a farm, you need to watch out for it. It's the most important disease of dairy. You are losing a lot of money, but you do not even know that you're losing a lot of money. I've seen a lot of farms in Nigeria where Frisians, who should be getting 30 liters of milk a day, is producing 4 liters of milk a day, 5 liters. And that's because, not many people understand the challenge that they are facing. So watch out for it, test for it, get a CMT reagent. You can, reach out and you get advice on where and how to get a CMT reagent. Test for mastitis. Ensure that you're able to tell whether you have clinical or subclinical mastitis on your farm, and use the appropriate dry cow therapy when you are planning for your dairy. And then finally, if you have mastitis while lactating, use the right lactating cow therapy. The secret to a successful dairy farming is in planning. Have a cycle, understand your cycle, have some SOPs. What do I do here? What do I do there? If you have institute dry cow therapy as part of the head health program on your farm. So it's not just restricted to FMD vaccination, CBPP vaccination, and helmintic or deworming. No, you should institute mastitis control as part of your head health program. And overall, if you're able to control mastitis, you would have saved yourself a lot of losses that you would not even have realized you're losing. So, I wish everybody, the best. I hope that some vets here are able to offer their clients and their better advice and better support. You can also access some of these products that can be useful in controlling mastitis. Thank you.
Okay, thank you so much, Dr. Ada. A lot of compliments and commendations are coming in the chat box, and I'm sure you can see that. Someone is thanking Dr. Ada and Farmalert. Thank you too. We know it's the festive, everybody has slipped gradually into the festive period. So we thank each and everyone for sparing out time to be here with us today. So technically, I would say this is the end of the session. Do follow us on all our social media handles, LinkedIn, YouTube, Instagram, and Facebook. You just have to type Farmalert and we're just there for you. Follow us to stay updated with all of our information, such as this, so you don't miss out. Thank you everyone once again for joining. See you next year. All right, everyone. Bye. And okay, lastly, if there are other topics you want us to address, please drop them in the chat box. It actually helps us with, with selection of topics going forward for our session for both farmers and veterinarians. So if you have any suggestion in the chat box for what are the topics you want us to address, kindly put it out there. Thank you very much, everyone, and have a nice day.